Joining me now is Dr. Bock from Women's Care Obstetrics and Gynecology in Eugene and Springfield. Dr. Bock is a specialist obstetrician, gynecologist, and an expert on women's health. And today we're talking about overall health and exercise during pregnancy. And Dr. Bock, it's a new year. What are your recommendations when it comes to maintaining overall health for women?
I guess my main recommendation would be to try to just pick maybe one thing. Don't try to change everything, and choose something that you could sustain that maybe is a lifestyle change. Start with something simple. Maybe choose cooking your food and just make that your goal, is to cook the majority of your meals instead of eating out or instead of eating processed food.
And how does working out impact the baby and a woman's body during pregnancy?
Women who work out during pregnancy, if you look at benefits both to them and to baby, obviously if you're working out consistently, you probably have less issues with gaining too much weight during pregnancy. Labor and pregnancy are hard. They're hard on your body, and so being fit and doing something on a daily basis during pregnancy makes it a little bit easier. Also, studies have shown that women who exercise have less risk for things like C-sections and less issues with fetal distress in labor.
All right, so it sounds like exercising is very beneficial to pregnant women. Is there a certain amount of exercise they should do?
Well, ideally, you would be exercising 20 to 30 minutes at least 5 days a week. Pregnancy is not a great time to start a new regimen. It's a good time to maintain your fitness overall. Walking is something that we can all do. You don't need special equipment or a place to go. If you get out and walk for 20 to 30 minutes, you should use perceived exertion to determine how hard you're working. So you should be able to talk to somebody but feel a little breathless.
And how can exercise and fitness help prepare a woman's body for giving birth?
Well, again, if we look at some of the changes that happen to your body during pregnancy, pregnancy alone is almost a state of training. You have increased blood volume, your resting heart rate goes up. It's almost like you're running instead of walking when you're not pregnant. So if you're consistently doing some activity during pregnancy, just generally makes it easier for you during labor and also recovery. If you've done something throughout your entire pregnancy, after you have your baby, you're going to feel better and bounce back a little bit quicker than if you've done nothing during the pregnancy.
That's great advice. And after giving birth, is there a certain amount of time women should wait before they start exercising again?
Women who have a normal, uncomplicated vaginal delivery really can resume their normal activities as soon as they feel ready. So I think mentally, a lot of women who exercise throughout the pregnancy really want to get back to doing something after the baby's born. But again, knowing that it's okay to just go out on a walk. You don't need to go do a run, you can walk, you don't need to go to the gym. At this point, it's really important to spend the time with your baby and bond, get some sleep, those kind of things.
Thank you so much, Dr. Bock, for joining us today and for sharing those tips with us. And for more information on fitness and healthy eating during pregnancy, you can visit womenscare.com to learn more.